larynx is voice box. It is made up of different cartilages, membranes, ligaments, and it will be acted by muscles. First, we have to discuss about what is the skeleton of larynx. If you take the skeleton of larynx, there will be 3 paired cartilages and 3 unpaired cartilages. If you take the first unpaired cartilages, first cartilage is thyroid cartilage. Actually, thyroid cartilage will be like this. Thyroid cartilage will be having the 2 laminae, right and left laminae of thyroid cartilages are united and becomes a single thyroid cartilage. That means, see, this is the right side and this is left side. It will be like this. 2 laminae of thyroid cartilages will be united in the anterior part and becomes a laryngeal prominence or Adam's apple. But the posterior part or the posterior border of the laminae of thyroid cartilage is free. Both will not be fused like this. Only anterior ends only will be fused. This is the fused part of both laminae. Actually, upper part of the 2 laminae will not be fused here, so that it forms a notch. This notch what we are calling thyroid notch. Only lower part will be fused and forms a laryngeal prominence. That means this is the right laminae and this is the left laminae. Actually, this is outside. Inside will be behind. So this is outside. We know that anteriorly these 2 are fused with each other, but the posteriorly they are not fused. But posterior border gives superiorly one extension, inferiorly another extension. The superior extension or the superior projection what we are calling superior cornu of thyroid cartilage. Inferior extension what we are calling inferior cornu of thyroid cartilage. So here also superior cornu and inferior cornu of thyroid cartilages. Then if 2 laminae are like this, there will be inner surface and outer surface. Is it? So this is inner surface. Inner surface is lined by mucous membrane, and this is the outer surface. So what you are seeing here, this is outer surface. So outer surface having 2 tubercles. Here one tubercle and here another tubercle. Here one tubercle and here one more tubercle. Right? These 2 tubercles are connected by one line. That line what we are calling oblique line. This is oblique line. This oblique line gives attachment to the sternothyroid, thyrohyoid, and inferior constrictor of pharynx. Okay. So here 2 tubercles are there. These 2 tubercles are connected by line. That line what we are calling oblique line. This oblique line will give attachment to mainly 3 muscles: sternothyroid. Another one is thyrohyoid. And one more is inferior constrictor of pharynx. Then here this is inferior cornu and this is also inferior cornu. These 2 inferior cornu are articulated with one more cartilage. That cartilage is cricoid cartilage, and it forms a synovial joint. So this is cricoid cartilage. Next to the thyroid cartilage, we have to discuss about the cricoid cartilage. So cricoid cartilage is signet ring shaped cartilage. That means if you see the cricoid cartilage in the side view, it will be like this. Anterior it is narrow, posterior it is broad. It is looking like signet ring. You know the signet ring, right? This is laminae and this is arch. Actually, signet ring means it will be like this. So this is the arch and this is the laminae. This is also same. This is the arch and this is laminae, right? So laminae will be present posteriorly, arch will be present anteriorly. That means if you take the side view of larynx, this is the thyroid cartilage and here is the laminae of cricoid cartilage, and this is the arch of cricoid cartilage. Then just imagine we are seeing the larynx from behind. In that case, I am drawing the thyroid cartilage like this. That means 2 laminae I will draw like this. This is thyroid cartilage. If you see from this side, you can see like this. If you see from this side, from behind, you can see like this. Right? Now here what I can draw, this is the laminae of cricoid cartilage. Here this is laminae of cricoid cartilage. Over the laminae of cricoid cartilage, there will be 2 more cartilages. Here they will be articulating like this. These 2 cartilages, what we are calling arytenoid cartilages. So this is one arytenoid cartilage, this is another arytenoid cartilage. Arytenoid cartilages are pyramidal in shape. Actually, they will be like this. This is the left arytenoid cartilage. If it is left arytenoid cartilage, this is the medial surface. This is the anterior projection. This anterior projection what we are calling vocal process. And this is the lateral projection. This lateral projection what we are calling muscular process. Right? And it is having the posterior surface. Imagine this is the posterior surface. And this is the lateral surface. This is the medial surface. Okay? And there will be projection up. I have drawn here. Here there will be apex. And this is the base. Base is resting over the cricoid cartilage. Apex is projecting up. Is it? So here apex, here medial surface, here posterior surface, here lateral surface. This is which process? Vocal process, and this is muscular process. So here I could draw only apex. This is the apex of arytenoid cartilage, and this is base. Okay. Of course, here medial surface will be there, and here lateral surface. And if you go little front, you can see vocal process, and this is muscular process. That means arytenoid cartilage having the base, apex, vocal process, muscular process, medial surface, lateral surface, posterior surface. Right? These are the parts of arytenoid cartilage. Then over the apex of arytenoid cartilage, there will be two more cartilages, one on either side. These cartilages what we are calling carniculate cartilages. These two are the carniculate cartilages. Then there is a fold from the arytenoid cartilage to the epiglottis. That fold what we are calling aryepiglottic fold. Within the aryepiglottic fold, there will be one more cartilage, one on either side. Those cartilages are present in the aryepiglottic fold. What is aryepiglottic fold? I'll tell you. Within that aryepiglottic fold, there will be two cartilages. In one aryepiglottic fold, one cartilage. In another aryepiglottic fold, one more cartilage. These two cartilages are rod-shaped cartilages. Those cartilages what we are calling cuneiform cartilages. So till now what we have discussed: thyroid cartilage, cricoid cartilage. These two are unpaired. Two arytenoid cartilages. These are paired. Two carniculate cartilages. These are also paired. And cuneiform cartilages. They are also paired. Then what is missing here? One unpaired cartilage is there. That unpaired cartilage what we are calling epiglottis. So this is epiglottis here. This is leaf-like structure. This is the epiglottis. This epiglottis having upper free border and two lateral borders are there. And it is having the root. It is attaching to the angle. See here, if it is thyroid cartilage, this is the angle. Okay, this is inside. Exactly at this place, this epiglottis is attached, having two surfaces. Which surface is this? If it is attaching like this, here like this. So it is having laryngeal surface and front surface is there. That surface is related to the tongue. Okay, lingual surface. Here laryngeal surface and this surface is lingual surface. Right? So the surface which you are seeing here is laryngeal surface. Okay? That surface, the front surface is lingual surface. Right? Now I have already told you, from the lateral border of epiglottis to the arytenoid cartilage, there will be fold. This fold, what we are calling aryepiglottic fold. This fold is aryepiglottic fold. Within this aryepiglottic fold only, rod-shaped cartilages will be there. These rod-shaped cartilages, what we are calling cuneiform cartilages. Right? Clear now? Okay. Of course, in between the two arytenoid cartilages, there will be one fold of mucous membrane. That fold of mucous membrane, what we are calling interarytenoidal fold of mucous membrane. What is it? Interarytenoidal fold of mucous membrane. Here this is interarytenoid fold of mucous membrane. Clear? So these are the different cartilages and their related structures. Thyroid cartilage, cricoid cartilage, arytenoid cartilage, and two carniculate cartilages and two cuneiform cartilages. If you wanted to go still more minor details, within this fold there will be one more cartilage will be there. That cartilage what we are calling cartilagotriticea. Okay? Cartilagotriticea. Cartilagotriticea. Right? So that much minor details they will not ask. Okay? But you remember, these are the different cartilages. If you take the histology of laryngeal cartilages, thyroid cartilage, cricoid cartilage, and base of arytenoid cartilage are hyaline cartilages. But apex of arytenoid cartilage, carniculate cartilage, cuneiform cartilage and epiglottis are elastic cartilages. Okay, so in the larynx we have discussed first element in the larynx, that is cartilages of larynx, right? Now the second element which we have to discuss is ligaments of larynx. Okay, see here, above the thyroid cartilage there will be hyoid bone, is it or not? So this is hyoid bone. There will be membrane which is connecting the hyoid bone to the thyroid cartilage. So that membrane, what we are calling thyrohyoid membrane. This is thyrohyoid membrane. In the lateral part and also in the median part, this thyrohyoid membrane is thickened and forms a ligament. Okay, so that here one ligament is there, here one ligament is there, here one ligament is there. So this is median thyrohyoid ligament, median thyrohyoid ligament, and two lateral thyrohyoid ligaments. And this is the membrane. This is one ligament of larynx, okay, or one membrane of larynx. Then there will be attachment between the thyroid cartilage and cricoid cartilage. Cricothyroid membrane. Cricothyroid membrane. Right? Then after cricoid cartilage, there will be tracheal rings are there. Is it or not? So here trachea will start now from here. This is tracheal rings. Right? In between the cricoid cartilage and tracheal rings, there will be membrane. This is the membrane. This membrane, what we are calling cricotracheal ligament. What is it? Cricotracheal ligament. So, what are the different ligaments which are present in relation with the larynx? Thyrohyoid membrane and ligaments, cricothyroid membrane, and cricotracheal ligament. Along with that, one more ligament is there which you have to discuss here. When you take the sagittal section, this is cut section of hyoid bone. This is the epiglottis, and here thyroid cartilage. There will be one ligament which is connecting the hyoid bone with the epiglottis. So this is the ligament which is connecting the hyoid bone with what? With epiglottis. So this ligament, what we are calling hyoepiglottic ligament. Hyoepiglottic ligament. So these are the extrinsic ligaments which are present in relation with the larynx. Recollect once again: thyrohyoid membrane and ligament, cricothyroid membrane, cricotracheal ligament, then hyoepiglottic ligament. Hyoepiglottic ligament. So these are the extrinsic ligaments of larynx. Then if we go for intrinsic ligament, see here, this is thyroid cartilage, and here you can see this is cricoid cartilage. See here tracheal rings, and over the laminae we can found what is this? Very good, arytenoid cartilage. This is arytenoid cartilage. Over the apex of arytenoid cartilage, yeah, carniculate cartilage first, then cuneiform cartilage. And here, in between the arytenoid cartilage and the epiglottis, there is a fold. What is this fold? Aryepiglottic fold. So this is aryepiglottic fold, because we have taken the section like this, right? So that's what we can see only one side. This is aryepiglottic fold. Right? Now, what is intrinsic membrane? Can you take that paper? One small paper. Imagine this is the lumen of larynx. This is lumen of larynx. Within the lumen of larynx, there will be one membrane. There will be one membrane. That membrane, what we are calling fibroelastic membrane. That fibroelastic membrane is intrinsic ligament of larynx. That means here laryngeal cartilages are like this. Inside the laryngeal cartilages, here like this paper, there is a membrane. This membrane is fibroelastic membrane. Right? So this fibroelastic membrane is deficient in the middle, so that this fibroelastic membrane can be divided into upper part and lower part. Are you getting the point? See, this is the fibroelastic membrane which is present inside the larynx or inside the laryngeal cartilages. Right? So that membrane, what we are calling intrinsic ligament, or it is a fibroelastic membrane. Right? So within this fibroelastic membrane, there will be deficiency in the center. That means it is cutting because of sinus of larynx, so that this membrane can be divided into upper part and lower part. and in between there is a gap. Is it? First we will discuss about this one. First we will discuss about upper part. This upper part is having upper border, lower border. Okay? See here, it is having the upper border and it is having the lower border. Right? So this upper border is going to form airy epiglottic fold, and here lower border is there. So this is the lower border. This is lower border. This is upper border. This is lower border. So this upper border is going to form what? Airy epiglottic fold, and this is the lower border. This lower border is going to form vestibular fold. This is vestibular fold. Right? Are you getting my point? So it will be like this. This upper border is airy epiglottic fold. This lower border is vestibular fold. This is vestibular fold. That means two vestibular folds are there. This is one vestibular fold and this is another vestibular fold. The gap between the two vestibular folds, what we are calling rhima vestibuli. What is this? Rhima vestibuli. Since we have taken the section, that's what I have drawn only one side fold, one side vestibular fold. But if you see in the in situ, there will be two folds, right and left folds. This is a gap. This gap what we are calling rhima vestibuli. Okay. So these two are the airy epiglottic folds and these two are the vestibular folds. So this ligament what we are calling quadrate ligament. This membrane has been divided into two ligaments. So upper ligament what we are calling quadrate ligament, since it is quadrangular in shape. Right? Then if you take the lower one, this is the lower one or the lower part of the fibroelastic membrane. This lower part of the fibroelastic membrane what we are calling conus elasticus or triangular ligament. Conus elasticus we can also call as triangular ligament. Right? So this triangular ligament also having two borders. This is superior border and this is inferior border. Superior border will form the vocal folds. So this is superior border. This is superior border. This superior border will form the vocal folds. And this is inferior border. This inferior border will be fuses with or attaches with the cricoid cartilage. It will be attaching to the inside of cricoid cartilage. So this ligament what we are calling triangular ligament. We can also call as conus elasticus. And we can also call as cricovocal ligament because from the cricoid cartilage to the vocal folds. So if you understand this concept, studying laryngeal cavity is very easy. Now we know how upper part has been formed, how lower part has been formed, and how in between the middle part has been formed. Because of the deficiency of this membrane, there is a middle part. That middle part what we are calling sinus. This is sinus. Okay. This is vestibule of larynx. This is sinus of larynx, and this is infraglottic part of the larynx. What I am trying to say here, this is the lower part. This is triangular ligament. It is having two folds. This is one fold and this is another fold. Right? These folds what we are calling vocal folds. In between the vocal folds, this is the gap. Like our space between the two vestibular folds. Here also there will be space between the two vocal folds. The space between the two vocal folds what we are calling rhima glottis or rhima glottis. Okay, this is what we are calling rhima glottis or rhima glottis. Understood? So with this we have described laryngeal cavity also. Laryngeal cavity having the upper part, middle part and lower part. This upper part what we are calling vestibule of larynx. The middle part what we are calling sinus of larynx, or we can also call it as ventricle of larynx. Then the lower part what we are calling infraglottic part. Imagine this is the larynx now. It is having superior part. This is vestibule. This is the sinus in between, and this is the lower part, infraglottic part. What are these two folds? These two folds are vocal folds. These are vocal folds. Usually when you are speaking, okay, that means during phonation, two vocal folds will be approximated with each other, and phonation will happen during expiratory phase only. In that phase only we can speak. During inspiration phase we cannot speak. Right? So when you want to speak, these two vocal folds approximated with each other, and expiratory air will be passing between these two folds passing between these two vocal folds, so that these vocal folds will be vibrated. When these vocal folds are vibrated, sound will be produced. Actually, it is a raw sound. Raw sound in the sense there is no any specific meaning. Once that raw sound enters into oral cavity, because of the manipulation of tongue, teeth, lips, soft palate, gums, cheeks, by all these structures, there will be manipulation to that raw sound, which leads to meaningful language. That we will discuss little later. So what I am trying to say here, there will be always friction between the two vocal folds. When there is a friction between the two vocal folds, there will be chance of tearing of vocal folds. That's what, for the protection or for the prevention of tearing of vocal folds, there will be some protective mechanisms. First one is, there should be thickest epithelium. So that's what vocal folds are lined by stratified squamous non-keratinized epithelium. Stratified squamous non-keratinized epithelium. Okay, is that only sufficient? Actually, if there is more friction, even that epithelium may tear. So that's what, it needs some lubrication. So from the sinus, just imagine this is the sinus. There will be one saccule will be formed just lateral to the sinus of larynx. Like this, there will be saccule. Just I am drawing with dotted line. This is the saccule. This saccule contains mucus secreting glands. Those mucus secreting glands secretes mucus, and mucus will be poured over the vocal folds, so that there is no much friction, so that we can speak without tearing our vocal folds, right? So this saccule, what we are calling saccule of larynx, or we can also call it as oil can of larynx. Saccule of larynx or oil can of larynx. Here only we will discuss about the laryngeal cavity, so that we no need to discuss separately. Laryngeal cavity having the three parts. This is upper part, this is middle part, and this is lower part. This upper part is present in between the laryngeal inlet and the vestibular fold. What is laryngeal inlet here, and what are the boundaries of laryngeal inlet? See here, this is the laryngeal inlet. This is laryngeal inlet. This laryngeal inlet is bounded anteriorly by superior border of epiglottis. Is it? This is epiglottis, right? Anteriorly by superior border of epiglottis. Posteriorly by, what is this? Interarytenoidal fold of mucous membrane. And on either side, what is this? Airy epiglottic fold. Airy epiglottic fold. These are the boundaries of laryngeal inlet. So when they ask laryngeal cavity, we have to discuss first what is laryngeal inlet. Laryngeal inlet is formed by anteriorly superior border of epiglottis, posteriorly interarytenoid fold of mucous membrane. On either side, airy epiglottic folds. Airy epiglottic folds. Then the lower part or lower boundary of vestibule is formed by vestibular folds. In between the two vestibular folds, there will be gap, as we discussed. That gap what we are calling rhima vestibuli. That gap what we are calling rhima vestibuli. Then if you come into the sinus, this is the sinus, the middle part. The sinus is present in between the vestibular folds and vocal folds. These two folds, how they have formed? Because of the deficiency within the fibroelastic membrane. So this area what we are calling sinus. Into the sinus there will be opening of saccule of larynx. This is saccule of larynx. So that saccule of larynx what we are calling oil can of larynx. Then below this sinus, this area what we are calling infraglottic part. This infraglottic part, superiorly it is bounded by vocal folds. In between the two vocal folds, this gap is there. This gap what we are calling rhima glottis or rhima glottis. This is about laryngeal inlet and the laryngeal cavity. Now we will discuss what are the different muscles which are present in the larynx. There will be different muscles which are present in relation with the larynx. Those muscles what we are calling muscles of larynx. These muscles of larynx, first if you take one extensive muscle, that means one muscle which is present outside the larynx, that is cricothyroid. That is a muscle called cricothyroid. That means from the cricoid cartilage to the thyroid cartilage. So this muscle is cricothyroid muscle. This is the tensor of vocal fold. You can also call it as tensor of vocal fold or tuning fork of vocal fold. Actually, musical instruments will be tuned. Means what? Strings becomes tight. Is it? Here also, because of this contraction of cricothyroid, this thyroid cartilage will be moving forwards, so that there is a tightness of vocal folds. Is it? So that's what this muscle, what we are calling tuning fork of larynx. This is tuning fork of larynx. Right? So this muscle is what? Cricothyroid. I will draw another diagram which is showing the transverse section of thyroid cartilage along with transverse section of arytenoid cartilage with two processes. So if you take the transverse section of thyroid cartilage, this is the transverse section of thyroid cartilage. These are two laminae. And here arytenoid cartilage. This is transverse section of arytenoid cartilage. That means it is having this process here. What is this process called? Vocal process. Vocal process to the thyroid cartilage by vocal folds. So these are vocal folds or vocal cords. These are vocal cords. So since it is giving attachment to the vocal folds, this process is vocal process. And this is the muscular process since it is giving attachment to the muscles. Now imagine this is the posterior surface of arytenoid cartilage. That means this is the posterior surface of arytenoid cartilage. This is posterior surface of arytenoid cartilage. What is this part? This is cricoid cartilage. This is cricoid cartilage. This is arytenoid cartilage. There is a muscle which is taking origin from the posterior surface of laminae of arytenoid cartilage. See here, posterior part is laminae, anterior part is arch. So it is taking origin from the laminae of cricoid cartilage and inserting to the posterior aspect of which process is this? Yeah, muscular process, like this. This muscle, what we are calling posterior cricoarytenoid. This muscle is posterior cricoarytenoid. So on both sides, like this. This is posterior cricoarytenoid. Actually, this posterior cricoarytenoid is abductor of vocal folds. That means here two muscles are there like this. When these two muscles are contracted, these two vocal folds will be abducted. That means there will be formation of space in between the two vocal folds. That means rhima glottis will be abducted. So whenever there is paralysis of this muscle, which leads to overaction of lateral cricoarytenoid, which leads to adduction of two vocal folds. So that what will happen? There is no respiration, which leads to death. So that's what posterior cricoarytenoid is safety muscle of larynx. Important MCQ. Posterior cricoarytenoid is safety muscle of larynx. Right? So this is the one muscle. Then there is another muscle. It is taking origin from the cricoid cartilage and it is inserting to anterior aspect of which process is this? Yeah, muscular process, like this. This muscle, what we are calling lateral cricoarytenoid. It is opposite to the posterior cricoarytenoid. Posterior cricoarytenoid is abductor and the lateral cricoarytenoid is adductor of vocal folds. When it contracts, vocal folds will be approximated with each other. Is it? So this is lateral cricoarytenoid. Then there is one muscle which is connecting the two arytenoid cartilages. This muscle, what we are calling transverse arytenoides muscle. Transverse arytenoides muscle. That means one arytenoid cartilage to the another arytenoid cartilage. So what is this? Transverse arytenoid. Okay. Then there is another muscle which is taking origin from base of one arytenoid cartilage to apex of another arytenoid cartilage. That means opposite arytenoid cartilage. Like this. This muscle, what we are calling oblique arytenoid. This muscle, what we are calling oblique arytenoid. It is taking origin from base of one arytenoid cartilage to the apex of opposite arytenoid cartilage. So this muscle, what we are calling oblique arytenoid. Actually, some fibers of this oblique arytenoid muscles will be extending or entering into the airy epiglottic fold. Airy epiglottic fold. Okay, like this. See here, these fibers will go like this. That's it. These fibers will go like this into the airy epiglottic fold. So this muscle, what we are calling airy epiglotticus. Some fibers of oblique arytenoid enters into airy epiglottic fold as airy epiglotticus muscle. So this is airy epiglotticus. There is a muscle which is arising from the thyroid cartilage and inserting to the epiglottis. Right? So how can I show that? imagine this is the thyroid cartilage. Okay, it is taking origin from thyroid cartilage, and okay, I will take the side view. Inside of the thyroid cartilage, I am taking the side view. This is thyroid cartilage. Here epiglottis is there. This is epiglottis. From thyroid cartilage to the epiglottis, this one what we are calling thyroepiglotticus. What is muscle? Thyroepiglotticus. Actually, thyroepiglotticus is opener of laryngeal inlet. See here, when this muscle contracts, there will be opening of laryngeal inlet. When aryepiglotticus muscle contract, there will be closure of laryngeal inlet. So these two muscles are opposite. Aryepiglotticus muscle is closer of laryngeal inlet, and thyroepiglotticus muscle is opener of laryngeal inlet. Then thyroarytenoid, arising from thyroid cartilage, inserting to the arytenoid cartilage. According to the some authors, some fibers of thyroarytenoid muscles are converted as vocalis muscle. So this muscle is vocalis. So these are the different muscles which are present in relation with the larynx. See here, this is cricothyroid muscle. Okay. Posterior cricoarytenoid, lateral cricoarytenoid, transverse arytenoid, oblique arytenoid. Oblique arytenoid continues as aryepiglotticus muscle. Then thyroepiglotticus, then thyroarytenoid. Right. So these are the muscles of larynx. Then what is the nerve supply of it? All muscles of larynx supplied by recurrent laryngeal nerve except this. What is this? Cricothyroid. This cricothyroid will be supplied by external laryngeal nerve. Remaining all muscles of larynx supplied by recurrent laryngeal nerve. All these muscles are supplied by recurrent laryngeal nerve except this muscle. What is this muscle? Cricothyroid muscle. This cricothyroid muscle is supplied by external laryngeal nerve. Right? And if you take the sensory innervation will be differs. If you take the sensory innervation above the vocal folds, that means upper part of the larynx supplied by internal laryngeal nerve, but the lower part below the vocal fold, sensory innervation by recurrent laryngeal. That means what I am trying to say here, recurrent laryngeal nerve is both motor and sensory. It is motor for the all laryngeal muscles except cricothyroid, and it is sensory for the lower part of the larynx or below the vocal fold. Larynx below the vocal folds. This is the innervation, right? Then if you take the blood supply of it, superior laryngeal artery and inferior laryngeal artery. Then phonation. Phonation means what? Speaking. How we are speaking. I already told you, when we are trying to speak, that time because of this muscle, what is this muscle? Lateral cricoarytenoid. Because of this lateral cricoarytenoid, two vocal folds will be approximated with each other, and expiratory air passes through these two vocal folds. So vibration will occur. This vibration will produce the raw sound. You must be seen trumpet and all, trumpet and some flutes. There will be two films will be there. When they blow air in between the two films, there will be production of sound. Is it? That sound is raw sound. Actually, that sound is raw sound. Once they play with fingers, there will be holes. Once they play with fingers, there will be meaningful music. Otherwise, if they don't play with fingers, just if they blow only air in between the two films, what will happen? Only raw sound will be produced. Is it? So, here also, air will be passing in between the two films, that means two vocal folds. So, raw sound will be produced. That raw sound will reach to the oral cavity. Once it reaches to the oral cavity, there will be manipulation by lips, tongue, teeth, gums, cheeks, palate. With all these organs, there will be manipulation. Because of this manipulation, that sound will converted as meaningful language or meaningful music. Right? So, this mechanism what we are calling phonation. Actually, so many things will be there. I made it simple. Okay? So, this is phonation. Clear? So, I think this is sufficient related to the larynx. Okay, if you wanted to say few applied aspects, there will be direct laryngoscopy, indirect laryngoscopy, and teacher's nodules are singers nodules. Actually, whenever we misuse the vocal folds, like changing the voice and talking more time, which leads to formation of some nodules over the vocal folds. These nodules, what we are calling teachers nodules or singers nodules. Teachers, we will speak always. Okay, singers, they will be singing always and changing their voice. So which leads to nodules. Okay, singers nodules, teachers nodules, right? And I already told you, if there is paralysis of posterior tricarotid, which leads to reduction of vocal folds. So some other applied aspects also will be there. These are sufficient for the discussion purpose.